Hi, I'm Dr. Darrell Story. In this video, we're going to talk about stroke. What is a stroke? What are the risk factors for stroke? How to recognize if you might be having a stroke and then what to do? And then lastly, what to do after you've had a stroke to try and make sure that you don't have another one. First, what is a stroke? So a stroke is a disruption in the blood supply to the brain that causes a sudden injury to the brain. The disruption could be because of buildup of cholesterol plaque in the arteries in the neck that gradually reduce the flow to the brain to the point that it's not getting enough blood flow and then suddenly causes the brain to malfunction. Or a stroke could be due to debris or particles that form in the circulation, often in the heart, due to certain heart conditions that then form a clot and travel through the arteries and lodge in one of the arteries inside the brain, thereby blocking the blood flow to that section of the brain. Also, the small arteries deep inside the brain can malfunction, causing a stroke. So what are the risk factors for stroke? Stroke is in a family of diseases called cardiovascular disease that also includes heart attack or myocardial infarction. And what these diseases have in common are the risk factors that can lead to them. One unavoidable risk factor is aging, that we're all subject to. But important risk factors that you can do something about include high blood pressure, probably the most important risk factor and a very, very treatable condition. Diabetes, high cholesterol, smoking are other risk factors that can be avoided or treated. There are certain rhythm disturbances in the heart. The most common one is known as atrial fibrillation, and this can be an important risk factor for stroke. Other lifestyle issues like obesity or a sedentary lifestyle without much exercise can be associated with a higher risk of stroke. Also, excessive alcohol consumption can also increase the risk of stroke. So as you age, it's important to have a relationship with a primary care doctor that can watch over your risk factors and make sure that you're doing everything you can to avoid a stroke. So how would you know if you're having a stroke? There are a lot of symptoms that a person can have that can indicate a stroke. It could be sudden difficulty speaking, sudden difficulty with vision, and that could include loss of vision in one eye suddenly or a loss of vision for part of the visual field or part of the world that you're looking at. It could be double vision. It could be droopiness or weakness of one side of the face, or numbness or weakness of an arm or a leg, or sudden difficulty walking or difficulty with balance. To boil it all down, what I like to say is if your body is suddenly malfunctioning, that could be a stroke. It could be any of the kinds of malfunctions that I mentioned. It doesn't have to hurt. Stroke usually doesn't cause a headache. And we all know that the symptoms of a heart attack are chest pain, and it's hard to ignore that when it's happening. But a stroke could be more subtle. So anything that just suddenly doesn't seem right, or some sudden malfunction in the way your body works, could be a stroke. And what should you do in that instance? You shouldn't try to call your doctor or call a friend or call family. The first thing you should do is call 911 and have emergency medical services come to take you to the nearest hospital. The reason for that is that we say that time is brain. The longer you have the symptom of a stroke without treating it, the more brain tissue is lost, and it can't be recovered once it's lost. So the first thing you should do is call for emergency services. If you're taken to a hospital and it's confirmed that you're having a stroke, if you have gotten there within enough time for the doctors to give you a medicine called TPA, which is also known as the clot buster, this can break up that debris or that clot that's inside the brain causing that stroke. But that medicine can only be given within the first 3 or sometimes 4.5 hours after the beginning of the stroke symptom. So it's extremely important to get to the hospital in a hurry and get this evaluation done quickly. Otherwise, that stroke is really not treatable. There are other treatments that are more aggressive that can be done within the first 6 hours of the onset of stroke symptoms in some people with large enough strokes or large enough vessels blocked inside the brain. This is called mechanical thrombectomy, and it's a relatively new technology that's just been proven in scientific research. Some hospitals offer this treatment, and sometimes it requires transfer to another hospital that does offer the treatment. And so, as you can imagine, it's logistically difficult to apply this kind of treatment to many patients because of a closing time window. But all the more important that when you recognize a significant symptom that could be a stroke, that you get to the nearest hospital very quickly. That treatment that I mentioned, mechanical thrombectomy, means that a doctor takes a catheter, puts it into an artery in your groin, threads it up through the circulation and into the brain, and actually pulls out the clot that's inside the brain. And in some cases, this type of treatment is necessary to restore blood flow to the brain. Often if someone has a stroke and goes to the hospital, whether or not they can be treated in the first few hours, they're hospitalized for a couple of days, at the very least, to get some testing done to try to determine the cause of stroke, to try to find out if it was because of blockage in an artery in the neck, for example, or due to a heart rhythm condition that can be treated specifically. If there are deficits or symptoms related to the stroke that can respond to rehabilitation, physical therapy, speech therapy, and these kinds of things, then this can be arranged. But when a person then comes back to see me after going through something like this, we need to sit down and try and figure out how to make sure that it doesn't happen again, or at least lower the chances of it happening again. The particular conditions, such as atrial fibrillation, have statistics that we can talk about the risk of future stroke. And depending on other factors, the risk of stroke with atrial fibrillation could be anywhere from a few percent per year to up to 10 or 15% chance per year of having a stroke without treatment. And the treatment for atrial fibrillation is a blood thinner. In people with blockages in their carotid arteries, the risk of recurrent stroke can also be very high, and many individuals are eligible to have surgery to open up the blockage and lower the risk of stroke. But for all comers who don't have any particular specific cause for the stroke, and that's actually most people with stroke, most people with stroke don't have one of these conditions that we can treat specifically. In most patients with stroke, the three areas that we talk about in terms of treatment are, number one, taking an antiplatelet medication, such as aspirin, or a prescription medicine called clopidogrel or Plavix. Number two, reducing blood cholesterol aggressively. Now, there are numbers that we talk about the good cholesterol and the bad cholesterol, but after a stroke, the science really shows that the lower the bad cholesterol, or LDL, the better. And we aim for very low targets with aggressive use of statin medication. The third area is to treat high blood pressure, or even to treat moderately elevated blood pressure. We know that high blood pressure is one of the most important, powerful risk factors for stroke. And after a stroke, lowering blood pressure lowers the risk of stroke a lot. So if you're watching this video and you've had a stroke and you don't really quite understand why it happened or what your treatment plan is, and you'd like to see a neurologist that can go over it with you, I'm happy to help. Give me a call. Bring me your discs with all of your images on them, and we'll go over it. Bring me all of your test results, and we'll go through what happened to you, why, and what we can do about it to maybe reduce your risk of having a stroke sometime in the future. In the meantime, also let's think about lifestyle issues. And certainly if you've had a stroke and you were ever a smoker, this needs to be taken away right away. Attending to good diet, such as a Mediterranean diet, has been shown to reduce the risk of stroke, as well as physical activity and avoidance of obesity or excessive alcohol use. So thanks for watching, and remember, if you think you're having the symptoms of a stroke, such as a sudden malfunction of your body, like we mentioned before, don't waste any time. call 911 and be brought to the nearest hospital, because maybe that stroke can be fully treated and that deficit can be wiped away with the proper treatment if you can get to a hospital quick enough.